On May 5th, 2009, a group of 8 individuals stood in the committee and shared their perspective that single-payer had been shut out of the conversation. On that day, I was lucky enough to sit near the press table and hand out press releases for this wonderful group that became known later as the Baucus 8.
We were all trying to find ways to make sure that this time, when Congress and the White House addressed healthcare reform, that we actually had an open and honest debate about healthcare reform, about what was best for the people of our nation.
Senator Baucus represented everything that was bad about the Democratic Party. And he had 3 days of hearings. He invited 43 or so people to testify, not one of which represented what we wanted, what we believe the majority of the American people wanted, which was get rid of the insurance companies, have everybody in one pool, cover everybody, save money. Everybody knew what the line was, but it wasn't happening because the corporations controlled both parties.
It had all the trappings of hearings and input and thoughtfulness and negotiation and considerations.
The discussion in the media and among political commentators and politically active people was that, wow, we're going to get real healthcare reform now. We're going to cover everybody. And it was just like it was so essential, I think, for us to pierce the veil, you know, to really let everyone see what's really going on.
It was like political theater, you know, watching people in the motions of what it would be like to talk about and debate a healthcare system that would improve the lives of American people. And we knew that behind the scene there were these deals being made with pharmaceutical, with the hospital industry, and with the insurance industry.
This was really a conversation of interest groups, and the interest groups that weren't there were the patients and the providers. And that offends. Such a misrepresentation of democracy is so troubling. It's really worth getting arrested for.
This little incident that we pulled at the Baucus hearing, it really pulled back the debate into talking about what kind of reform was really needed in order to provide universal coverage for everyone in America.
What we need is the care that Medicare, that the VA provide for everybody. We need improved and expanded Medicare for everybody.
Take the profit motive out of healthcare. Any of us can afford to get the healthcare we need.
You shouldn't walk into any kind of healthcare provider and be asked, what are you eligible for? That shouldn't be the first question that's asked. The first question that should be asked is, what do you need? How can I help you? And for too many people, and too many people that I've gotten to know, they've only been able to get care when they've hit the absolute bottom.
Every single day I hear the horror stories that my patients tell me about trying to negotiate the murky, muddy waters of the healthcare system, whether they're insured or uninsured. So that's what really motivated me that day to just stand up and say enough is enough. The emperor has no clothes.